Yeah, we conducted a phase 1 trial of dordaviprone or ONC201. It's an oral weekly medicine. In a preclinical studies, it has shown activity against leukemia cell lines regardless of TP53 mutation or complex karyotype. So we designed a trial to prevent post-transplant relapses in this high-risk population. So it was a single-center phase 1 trial where we started with a lower dose of 250 milligram and went up to a highest dose of 650 milligram once a week. We determined that the drug is safe without any dose-limiting toxicities. The adverse event rates, particularly grade 3 or higher adverse events, were relatively low at 45%. 15% were considered related, and that's quite comparable to the post-transplant complications we see in people without maintenance as well. One of the remarkable aspects of this drug is in preclinical studies, it has shown to affect leukemia stem cell, but not affect the normal bone marrow cells. So we expected that cytotoxic effect would be relatively low. And in our trial, we did find that grade 3 or 4 cytopenias were quite low at 10 to 15%, which is much less than what we would expect, for example, with azacitidine. We also included other endpoints such as survival, relapse-free survival. At 2-year overall survival was 70%, which we think is promising given the high-risk nature of these patients and high likelihood of relapse. Relapse-free survival was 60%. Non-relapse mortality was very low at about 6%, particularly in a predominantly older adults who had significant comorbidity burden and impaired physical function at the time of diagnosis. We also captured health-related quality of life and functional measures and demonstrated that both in terms of quality of life and changes in physical function, there were no significant decline on an average. So that provided additional suggestion that the drug is well tolerated. So we hope to move it forward and consider a phase 2 trial in the future.